So switching gears a little bit, we are in Pennsylvania, and this is one of the first states to mandate insurance coverage for children with autism. Has Pennsylvania's insurance coverage changed things from a service delivery point of view?
That's a really good question, and I don't think we know the answer to it yet. And that's sort of the other half of my research is, so if some of it is this very granular approach to trying to figure out how to implement evidence-based programs in these kinds of settings. The other half of my research is more the 1,000-foot view. That is, how do we organize, finance, and deliver services through public insurance, private insurance, or the education system to enhance outcomes for individuals with autism and their families. And Pennsylvania is one of 29 states now that's passed an autism insurance mandate. And this has become sort of almost a celebrity cause that private insurance companies aren't pulling their weight, and they are unfairly denying services to children with autism, and we need to call them to task and have them cover these services. And mostly it's been focused around intensive behavioral interventions, but also the screening and diagnostic process and medications. And it is true, a lot of private insurance companies have denied coverage. And that was the impetus for the mandate in Pennsylvania, as it was in a lot of other places. Pennsylvania has a very generous Medicaid program for people with autism. And so a lot of individuals with autism, by virtue of the diagnosis, are eligible for Medicaid reimbursed services. So Pennsylvania is a little different than a lot of other states. And the mandate actually has created this tension now between the public insurance system and the private insurance system about who's the payer of first resort, who's going to cover what the qualifications are for someone who's going to provide these services, what the quality assurance process is going to be. And so getting the mandates passed, at least in some states, is going to be a really important first step to getting these services covered. It may be necessary or not, but it's certainly not going to be sufficient. That we have a long way to go, even after the mandates are passed, to make sure that quality coverage is available. So for instance, if I'm an insurance company and I'm mandated to provide these services, all I need to do is set my premium or my reimbursement rate so low that no provider wants to enter the market, or set the bar for licensure or credentialing so high that it makes it difficult for providers to enter the market. There are a lot of other ways to game the system, and I think we're going to have to figure out a better way for public insurance, private insurance, and the education system to have either clear demarcations of responsibility or collaborate around providing services for these kids and adults whose needs so uneasily straddle all these systems.
So in regards to what you just said about gaming this system, some people have speculated that there may be some more cases of diagnostic substitution, and I was wondering what your thoughts were on that.
Because of the insurance mandate.
Because of the
so
insurance
the idea
bill.
that now there's an insurance mandate, and if I have a child with idiopathic intellectual disability, they may benefit from ABA services as much as a child with autism, right? So why not call them autism, and then I'm going to get these services. So that's quite possible, and it's one of the dangers about doing things that are diagnosis specific, rather than targeting services to the needs of an individual as opposed to the diagnosis. And I'm not sure exactly how we're going to get around that. We did some research simulating what would happen in kind of what you might call perfect storm conditions, where the number of children diagnosed with autism in the community increased dramatically beyond the community prevalence, and everyone used up to the dollar amount cap for these mandates. And what we found was, under those perfect storm circumstances, people's premiums went up an average of 2.3%. So, I mean, we talk about the autism epidemic, but the reality is that it's still such a relatively low prevalence disorder that we're not talking about potentially huge increases in premiums as the insurance companies have been claiming.
Well, that is really fascinating. But Dr. Mandell, thank you so much for your time.
It was my pleasure talking with you. Thank you.